And by the way, all of my lectures are on my website. They're all free. You can have your friends, if you like this lecture, you can have your friends in Singapore watch it, later on this evening. It's free. I did it first in the year 2003. Hasn't changed much since then because the truth doesn't change. The truth is basic, it's simple, it's easy to understand, it doesn't change. The world is still round, no matter how many people you have on it to say, all I see is flat, So anyway, if you look at my work and you say, well, why doesn't he update it? Well, I do update it. I update it in newsletters and commentaries I make, but the basic foundation doesn't change. So let's talk about dairy products. What we're talking about here is we're talking about cow's milk. Primarily, we could be talking about goat milk or sheep milk or whale milk or mouse milk or whatever. We're talking about cow's milk primarily. You recall that the reason that
for 1 second, you need to put it in presenter view.
All right, thank you. All right. There you go. How's that, Heather? Are we doing on all cylinders now?
Yep, perfect.
Well, you met Einstein. I told you the basic problem with feeding Einstein baked potatoes, it's not his food. And likewise, you shouldn't be eating mice or birds or cows or pigs. These would be the muscles of these animals primarily that you're eating. We do eat other parts of their bodies, but muscles primarily. And then you'd also be talking about the secretions of animals. So there we're talking about mammalian milk, we're talking about mammals. Anyway, it's just the wrong food. That's it. Basically, it's the wrong food. That's why your kids are sick. That's why you're sick. It's the wrong food. Cat milk would be ideal for this little animal's kids, except it was a male. So anyway, on the way out to Sebastopol, if you left our resort, we would be taking you out to Sebastopol where Dr. Lim was busy seeing 40, 50, 60 people, because we used to take 40, 50, 60 people in every live-in residential clinic. But now we have limited to, less than 30 or less people. But he would have to see them over 2 or 3 or 4 days, as I did. And I saw the patients myself prior to Dr. Lim being trained and taking over. And during the downtime, we would send people out to the coast. They'd get to see the place where I would windsurf and, the Pacific Ocean. And on the way out there, they saw this cow. This cow, to me, represents the dairy industry. It represents fake information. This is a fake cow. It's a metal cow, and you can see there's some real cows sitting behind it, but this is a fake cow. And the dairy industry puts out fake messages. When you were educated about what to eat, you were educated primarily by the food companies. And they have had this massive campaign to make you think you should eat like a calf does. And they have all kinds of teaching cows. They get a tremendous amount of promotion as teaching cows. They get brochures put into classrooms. They get ads on TV. These are teaching cows. Like, for example, when I was growing up in the Midwest, we had Chloe. Chloe was our teaching cow. And when I moved to Hawaii, she changed her name to Lonnie Moo. And if you were going to drive up Highway 101 in Santa Rosa from San Francisco, you would see brochures, signs, billboards on the side of the highway that said, Chloe tiptoes through the tulips. We have a cow named Chloe, and she's the teacher of all our children, all our doctors. Oh, what a nice cow. Well. Yeah, right. I don't know what to say there, Heather.
So it should be down in the lower right-hand corner.
Well, maybe that'll work.
Those arrows. There
we go. Okay, we'll do that. I've got a couple of other slide changes that don't seem to want to cooperate. Let's be clear. In my discussion, I'm talking to you about cow's milk. I'm not talking about human breast milk for human babies. Human babies need human breast milk. To do otherwise increases the baby's risk and the mother's risk of various diseases. For example, the risk of crib death is increased by 2 to 4 times. This is based on 17 studies, 12 of them showing this relationship between SIDS, or crib death, and bottle feeding your baby. I have 7 grandchildren. 5 of them were fortunate enough to be breastfed. For those 5, I didn't have to worry about this grim statistic, and that is that the risk of pneumococcal pneumonia during the first 3 months of life is 60 times greater in a bottle-fed baby. Bottle-fed babies have 10 times the risk of hospitalization. They have problems with IQ, speech difficulties from bottle feeding as opposed to breastfeeding. And they also have other problems later on in life. They have increased cancer risk, infections, asthma, eczemas as children. And they also have an increase in cancers like lymphomas and leukemias. Now, this tendency to be sicker when you happen to be bottle-fed carries on into adulthood. I used to tell my mother when she was living that if she'd given me more than 3 weeks of breast milk, I would have had Larry King's job. But, I didn't have that advantage. So as a result, because of being deprived, I could consider myself at increased risk of obesity, heart disease, diabetes, multiple sclerosis, food allergies, and all kinds of serious bowel problems. Well, that's either because I got started out in a bad way with bottled milk, or it could be that I was raised in a family with a tendency towards bottle feeding, which happens to also, by no coincidence, be a family that is wealthier, going out to eat more, eating more steaks and other rich foods, ice cream, etc. You see, less privileged people up until recently had to breastfeed. They couldn't afford otherwise. And likewise, they had to live on beans and rice and potatoes and vegetables and couldn't afford the rich foods. I realize all that's changed. I would rather believe that this is an education and not something that I'm trapped into because my mother could not breastfeed me for more than 3 weeks. Now, I told you that 5 of the 7 grandchildren I have were breastfed. Occasionally, it happens that you cannot breastfeed a baby, and we had that difficulty in our family. Well, it was a problem because I knew the things that I'm going to share with you today. I knew it wasn't a good idea to feed formula to kids, but what choice did I have? Well, the choices I had was I could have gotten a surrogate mother, not easy to find. I could have ordered breast milk from a breast milk bank, easy to find but expensive and inconvenient. Or I could have fed the baby formula. Well, I started with the consideration that the milk that comes from a surrogate mother, likely, and certainly the milk that comes from a breast bank, certainly would be highly contaminated with pesticides, herbicides, other chemicals. You see, when you breastfeed, the baby ends up being the end of the food chain. The baby sucks all the chemicals that the mother's ate out of her body. Within 6 months, half of the chemicals in a mother's body are dumped into her baby through her breast milk. So I decided I wasn't going to have this child, along with the parents, of course, to breastfeed. I wasn't going to have them have breast milk that was likely to be highly contaminated. Right, it might have been taken care of as far as the AIDS virus goes and hepatitis virus, etc. But not the pollutants. They do nothing about the fact that these women eat the rich Western diet, which is high on the food chain, which is heavily contaminated. Well, we ran into a little bit of a problem initially, and that is the babies didn't like the formula that I picked because it was a denatured formula. It was a formula that was made of cow's milk that had the proteins denatured by a special process. And this denatured formula, which you could buy in the stores, you can buy it in the United States in stores, you can't buy it in New Zealand in stores, but you could buy it in the United States in stores. This formula tastes terrible. Well, it tastes terrible because they don't put any sugar in it like they put sugar in the regular formula. So we bumped up the sugar content to the level of the regular formula for this denatured cow milk protein formula that I thought was the healthiest for these babies. And guess what? The kids loved it. And then when time went on, we decreased the amount of sugar. If you want to read about how to make that formula, it would be in a newsletter that I wrote on children. So you go to my hot topics, you click under pregnancy and children, and you'll see a whole newsletter I wrote about the diet of children. And it tells you how to make this particular kind of formula. All right. Well, the food industry has got a lot of help from the U.S. government. The U.S. government, the USDA, has a responsibility to Americans. That responsibility is to take care of the public's health. So they do so with the dietary goals and the dietary guidelines and other enactments. But their job is also to take care of agribusiness. In other words, the dairy farmers, the meat farmers, the pork farmers, the fish people. That's their job, taking care of agribusiness. And I have to tell you, folks, agribusiness almost always wins out. Well, one of the programs that really made a big dent on the public's health, made it much poorer, and helped industry was the development of checkoff programs. There are checkoff programs for beef, for pork, for various industries, including a checkoff program for milk. This program for the dairy industry raises $300 million a year. What they do is they collect that money from individual farmers who pay 15% or 15 cents on a gallon, 100 pounds of milk. Importers pay 7.5 cents on 100 gallons of milk. And they pay all that money into this central organization called Dairy Checkoff. And from that organization, they pay for marketing and research so that you'll buy more dairy products. Today's Dairy Checkoff focuses on a mission to grow sales of and demand for dairy products. That's their job. And they'll do anything, including pay for research. They'll pay for $200 million worth of research every year. This is the amount of payment, millions of pounds of dairy distributed by Dairy Management Incorporated from 2016 to 2018. You've seen they've been very effective at their marketing programs. I've also heard that dairy has taken some hits because of the non-dairy milks that are becoming so popular. But leave it to say they're trying, like any industry, to become as, well, they should, to become as successful as can be, even if the industry sickens and kills millions of people. Dairy Management Incorporated, they continue to do research showing dairy's role in public health, nutrition, including important work on furthering the understanding of the role of full-fat dairy products in a healthy diet. You see some of the money they spent just in a year on scientific papers and projects. You can be rest assured that every one of those scientific papers that were paid for by the dairy industry reflects positive benefits on dairy products, or they'd never hire those researchers again. That's the way industry works. That's the way industry advertises. They hire researchers to do research. They show their products work, and then they put that research in medical journals, food journals, and in advertisements. Right here, you see they're paying for that research. They're acting like a business. Now, the problem with dairy, with milk, is that it's the wrong food. Just plain and simple, the wrong food. Every year for the past 20 years, we've taken people on 1 or 2 trips around the world. They were called the McDougall Adventure trips. We started those because people would tell us we'd go on your diet and then we'd go on a cruise with somebody else and we'd gain 10 pounds in a week on a cruise. Believe me, they gained 10 pounds in a week on a cruise. So they kept asking me, well, would you put together some trips so we could go and eat well? Well, we started doing those in, I don't know, 1993, I guess. And we've been to various places, Panama and Costa Rica and Galapagos, and we're to the parade at the Rio de Janeiro. They canceled this year, by the way. They canceled Carnival because of COVID. Anyway, we took groups all over, particularly these hemispheres, the North and South Hemisphere and the Central Americas. And on these trips, people would go and have a great time. We'd collect between 80 and 150 people on each trip. Great time. Met wonderful people, just like you're meeting here in this particular program. Had a wonderful trip, got to relax, enjoy themselves. And in this particular trip, I decided to put this slide, one of the trips I decided to put this slide together. And it was based upon an observation that I made on our trips to Hawaii. Is on our trips to Hawaii, we would always take a trimaran out in the ocean. And we would see these mammals because we went in the wintertime. And there was these huge mammals. They must have weighed, I don't know, 10 tons. Their offspring weighed a ton. And they would wave at us, the big flippers up in the air, waving at us. Well, I found out the story about these mammals. These mammals traveled all the way from Alaska down to Hawaii, didn't eat, had their calves mated, and they went all the way back without eating. The mothers did, feeding the babies all the way back to Alaska, and then they ate. Marvelous this breast milk must have been for baby whales, for these calves to make that long trip, for these mothers to survive that long trip back and forth. Nature is so kind. Can you imagine if you lived on whale's milk? Oh, High octane, to say the least. All right, let's talk about how this applies to human beings. Let's take a look at the nutritional content of various milks and see how they support the growth of various mammals. You know, in mammalian research, if they're going to decide what a mammal should eat, an adult, they look at the milk of that mammal to get some clues as to what the composition of the adult diet should be. Yes, they do. That's what good researchers do on mammalian milk. Anyway, if you look at mammal milk and you look at the nutrient content, you find something very interesting that's necessary to support the growth of various animals. Look at the protein content of human breast milk, for example. It's 1.2 grams for every 100 grams. Well, a baby doubles in size every 3 to 6 months. They don't grow very fast. You become an adult when you're 17 years old. A cow has 3 times as much protein to support their more rapid growth, and they double in size in 47 days. A dog, 7 times as much protein as a human being, and they double in size in 8 days. And a rat doubles in size in 4.5 days, and it has to have a very high protein content to support that growth of 11 times what a human being would take in. Rats grow to adult-sized rats. They get to be 4 to 5 months of age. So here it is with other nutrients. You see the nutrients of human milk compared to cow's milk. Human milk has 1/4 the concentration of nutrients as does cow's milk. Why? Because we're supporting a low rate of growth. Just imagine what happens when you feed a fuel to an animal designed to grow slowly, a fuel that supports rapid growth. And you wonder why you're growing so big and you're aging so fast. Well, this is us getting off to a bad start, I'll tell you. Anyway, seems kind of ridiculous to feed cow's milk to babies. Hey, what if we did this? What if we switched them around? What if we had a human mother feed a calf her milk? We'd have the Farm Animal Reform Group out. We'd have all kinds of animal rights groups out punishing this person, putting them in jail for causing malnutrition of that poor baby calf by feeding it human breast milk. Oh, so sad. But we can feed millions of babies cow's milk and we get away with it. Don't think that's right. All right. Milk builds strong bones because of the calcium, right? Isn't that how we were pitched cow's milk for all these years? Well, investigators finally got around to looking at this, and they published their studies in the year 2000, the American Journal of Clinical Nutrition. Ricker and Haney, these were the researchers, Weinstein and Kumdrick. But they were the first ones and the only ones. So it's been 20 years. Nobody else has published such a review. This is the only review out there. What they looked at is the effects of cow's milk on the bone growth of human beings. And what they found is there were 57 studies, and 21 of the studies were quite good. Of those 21 studies, 57% showed no benefit, 29% showed favorable effects, and 14% showed adverse effects of feeding cow milk products to human beings. It hurt the bones. Well, what you don't realize is almost every one of these studies was paid for by the dairy industry. I've read all these papers. The dairy industry, and still, 57% showed no benefit and 14% showed cow's milk hurts the bones. There's a famous kind of study, it's the gold standard. It's the kind of study we did for our diet and multiple sclerosis study at Oregon Health and Science University. It's called a randomized controlled trial. It is the gold standard of research. That's how you prove something right or wrong. There have been 7 randomized trials done on the effect of cow's milk on human beings or cow's milk substitutes on human beings. And of those 7 studies, I can find the financial support of 6 of those studies. 6 are paid for by the dairy industry. Only one I couldn't find the financial support for. 6 of the 7 studies were done either on young women, adolescents, or they used other than cow's milk. Only 1 study was done on the effect of cow's milk products on postmenopausal women, which is what you really care about, is what's the effect of eating cow's milk on my bones when I get to be an older woman? And that study, which is done by Ricker and Haney, employees of the dairy industry, showed that those who received the cow's milk lost more bone. What they fed was 3 to 8 ounce glasses of skim milk. Now, skim milk is high protein. Why? Because they take the fat out. So they fed them 3 8 ounces of skim milk, 3 8 ounce glasses of skim milk for a year. And they found, look at the chart down the lower left-hand corner. Those who got the milk supplement lost more bone. Paid for by the National Dairy Council, done 20 years ago. They will never do that study again. It doesn't work. All right, the protein content, this is what they say in the paper. In their paper, they had to be honest because they knew their colleagues would get them if they weren't. But they have enough flowery language to fool the public and the press. The protein content of the milk supplement may have a negative effect on calcium balance, possibly through an increase in kidney losses of calcium or through a direct effect on bone resorption of the gut. This may be due to the 30% increase in protein intake during the milk supplementation. Understand, skim milk is high protein. It's 41% protein because you've taken the fat out. So you dump this protein load into women, and they did this in this one study, which will never be repeated, which showed that it hurts the bones. So this is a more recent study. This was actually published today. That's why I threw it in there. It's from the North American Menopausal Society. It's from their journal. Today it was published. Today, which is, what is today? I don't know. It's sometime in September. What's today, Mary? 28th. So 28th of September. Today they published this. In this group of 3,320 pre- and postmenopause or perimenopausal women, dairy food intake neither had an association or a loss of, no indication to help reduce the risk of bone fractures. You read the whole conclusion there. It's just published today. All right. So why do you have this adverse effect on the bones, and how do you get osteoporosis? It has to do with one of the primary functions of the bones. You know the bones are there to keep you upright, right? Keeps you standing, keeps you from falling apart. Well, they have other jobs too. One of their jobs is to regulate the acid-base balance of the body, regulate the pH of the body. So the bones dissolve, release alkaline material when you take in acid, and as a result, the bones, as I said, dissolve. So when you take in an acid load, the bones dissolve to neutralize the acid. Otherwise, you die. A neutral pH is 7. The pH of the human body is 7.4, slightly alkaline. And if you run below 7 for any length of time, you die. So anyway, you eat acid foods. Acid foods are your hard cheeses, which is the most acidic of all, your dairy, your eggs, your meats, your seafood, your shellfish, etc. Those are your acid foods. So the bones have to dissolve. They release carbonates and phosphates and other alkaline materials, and they neutralize the acid. Your alkaline foods, the ones that support the acid-base status of your body being slightly alkaline, are your fruits and vegetables. Let's take a look at this in terms of some numbers. Well, these are the amino acids. The reason you take in all these acids is because these are high protein foods. I mean, if I say, you told me a couple nights ago, I say meat, you say protein. You probably know that protein is made of amino acids. Those acids turn into dietary acids. One of the acids that's particularly acidic is sulfur. Cysteine and methionine are your sulfur-containing amino acids. They break down to sulfuric acid. All right, so the bottom line is that you end up with an acid load. Here's the acid load you take into the body. Okay, these are relative numbers, but they convey the point to you. Beef has a positive acid load of 6.3, chicken 7.0, fish 9.3, and cheddar cheese 10. It's the most acidic of all foods that you consume. Look at your fruits and vegetables. Minus means alkaline. Potatoes -5, peas just +1, grains just +1. You'll hear people say, don't eat legumes and grains because they're acidic. Compared to what? Cheese is 10 times more acidic. Now, we don't eat just grains and legumes alone. We eat it with spinach, which is -56 alkaline, tomatoes, which are -18 alkaline. We serve you an alkaline diet to preserve your bones. And so it does preserve your bones. You see in worldwide studies of populations of people, this is data that cannot be argued against. We see when we compare the risk of hip fracture worldwide to the animal protein intake, a straight line correlation. In countries like Papua New Guinea, where 92% of their diet used to come from sweet potato roots and leaves, They had virtually no osteoporosis. These people, they fought battles. They were strong athletes. They grew to normal height. The Highlanders of Papua New Guinea. In rural Africa back in the 80s, I used to look for cases of osteoporosis among rural Africans or articles that address that. They couldn't find any cases of rural African women with hip fractures. That was in the 1960s. You say, well, people didn't live long enough. They died too soon. 10% of the African population was over the age of 60 when these studies were done. Your Asian countries, much less hip fractures. You're going to your, quote, modern countries, your high protein, your high dairy intake countries. And what do you see? Finland, United States, New Zealand. High rates of hip fracture due to the protein. Now, when you take a look at calcium intake and you compare that hip fracture rate, you see a similar correlation. That has to at least tell you that dairy does not protect your bones and actually may hurt them. Okay, let's get on to a serious part of this conversation. Got milk? Got disease. Before you met me, I mean, before you came to your computer screen, before you met the team, you knew that dairy products were high in calories. You knew that. They made you fat, which leads to obesity, diabetes, cancer, heart disease. You knew they were high in fat, which the fat you eat is the fat you wear. Fat is the strongest promoter of cancer. The fat you eat is the fat you wear, i.e. type 2 diabetes. High in saturated fat, so that's a particular kind that really damages the arteries of the brain and the penis and the heart. You knew that long before you met me. High protein damages the kidneys, causes osteoporosis. I explained to you how that happens. That calcium that comes out of the bones, it solidifies in the kidneys so that you develop calcium-based kidney stones. Almost all kidney stones in Western countries are calcium-based. Over 90% of the stone is made of calcium and oxalate. And the oxalate comes from eating fats too. So it's a whole long story. But anyway, that's how you get kidney stones. The bones solidify in your kidney system. High acid diet, I've explained to you the nature of how acid causes the bones to dissolve and they re-solidify in the kidneys, just in the right components to form these stones. High cholesterol, you do know now that cholesterol is only present in relative amounts, in any significant amount, only in animal foods. And cholesterol is tied to all kinds of problems. Dairy is the #1 cause of anemia. Why? Because it's very low in iron, plus it causes bleeding. In children, the #1 cause of iron deficiency anemia is known as Heiner's syndrome, is due to consuming cow's milk. You cannot correct it even with iron or blood transfusions. The only way you can fix the kids is to take them off the cow's milk. Then the iron can be absorbed. Then the calcium and phosphorus from the cow's milk isn't complexing the iron. And then you stop the bleeding of the intestinal tract caused by the dairy protein. No dietary fiber, so it leads to constipation. Low in carbohydrates, so it leads to fatigue. I mean, cheese is 2% of the calories is carbohydrate. Almost none. You're on a diet that's 70, 80% carbohydrate for winning. No vitamin C, poor tissue healing, severe vitamin C deficiency usually leads to scurvy. Deficient in essential fats, so if you happen to be a person with multiple sclerosis, I could make a valuable argument that you started out poorly in life because of the dairy foods you were fed instead of the essential fats your nervous system needed. High in environmental contaminants. Again, we've talked about the food chain. We've talked about bioaccumulation, biomagnification, how the fats in our foods suck up the environmental poisons because these poisons are fat soluble and concentrates them in our body fat as you move up the food chain. So you get these huge concentrations, maybe 1,000-fold higher than on the plant foods. And these chemicals are known to cause cancer, both initiate and promote. They're known to cause brain damage. Sheep herders who dip their sheep in these pesticides have a high rate of brain loss. And Parkinson's disease has clearly been shown to due to organophosphate intake and poisoning of the substantia nigra of the brain. All right. Allergies, autoimmune diseases, and just common allergies like snotty nose, ear infections. Dairy's dirty. It's full of infectious problems, infectious diseases. We'll get into that even more as we go along. If you look at the recall of various foods, what you find, these don't make headlines very often, really. The only ones that make headlines are the ones that make you believe there's nothing safe to eat. But let's just say every foodborne contamination has its roots in other animals. Let's touch on this for just a minute. We're animals. As a result, other diseases that infect other animals in the animal kingdom, because our mechanisms, our physiology, our metabolism is so similar, diseases from dogs and cats and sheep and camels, etc., can move to human beings and make us sick. But the plant kingdom is totally different than us. Diseases that affect plants don't affect us. You have no friends with Dutch elm disease or tobacco mosaic virus or aphids. The only way that your vegetable foods get contaminated with animal bacteria, viruses, and other microbes is by human or other animal in contact. Like, for example, a worker walks through the field of cabbage and poops all over the cabbage. Or a cow walks through a field of cantaloupe and poops all over the cantaloupe. Or like they did in the Douala apples up in Washington, the apples fell on cow dung. Anyway, that's how you get the animal foods contaminated, is by animal waste. And the number one recall of all animal foods is dairy products. Things like deadly E. coli, forms of tuberculosis that make you very sick. Anyway, the dairy industry knows this, by the way. The dairy industry knows this. And so they set out a rule back in 1993. And that rule, because they knew about the infection problem, and these are nice people, just like you and I. You've got to realize the people that are in these food industries, these drug industries, are just like you and I. They're not particularly bad people. They're just trying to make a living. And so they realized they had a problem in the early 90s, and they decided that they ought to do something to protect the consumer. So they made a rule, and that rule said that they would no longer sell dairy products that were infected. And the criteria for infection is 750,000 pus cells per cc. cc is only that big. You know, it's like a drop. And if you have more than 750,000 pus cells, white blood cells, in that drop, you can't sell it. That was an internal document. That had nothing to do with government regulation. Well, they kept to that. Like, for example, their report in their own journal from the state of New York showed that in a sample taken, they had 363,000 pus cells per cc to fight the 25,000 bacteria. Now, truth in advertising, this is why they won't make me Surgeon General. Is I would make them label their milk mustache. I'd make them label their milk mustache, truthfully. One of the more serious problems I'd like to talk to you about, and I think it's serious because not only will it get an emotional reaction out of you, because it's been totally ignored, except for the things that I'll tell you about. And that's the infection of our animal foods, our animal foods, with viruses that cause cancer and viruses that cause immunodeficiencies. There is a bovine immunodeficiency virus, which was so similar to HIV, human immunodeficiency virus, that back in the 70s and 80s, they couldn't tell the difference. They were structurally the same. Yeah, their makeup was so similar, they couldn't tell the difference between BIV and HIV. Through more advanced technology, they have been able to tell the difference between the two. The other one I'd like to talk about, and in fact, this is what I'm going to talk to you about mostly, is bovine leukemia viruses. 40% of the beef herds and 64% of the dairy herds are infected with bovine immunodeficiency viruses, according to current research. And according to research you can pull up right now, if you want to take the trouble, if you happen to have the book, it's found in my newsletters under dairy. And if you happen to have the book, The Starch Solution, It's in a chapter that of the book that Mary and I particularly enjoy, which is When Friends Ask, Where Do You Get Your Calcium? At the end of that chapter is a whole section on dairy is dirty. And then there it gives you the reference for the Health and Human Services website section, which tells you that 8 out of 9 dairy herds in this country, the United States of America, are infected with bovine leukemia viruses. And in that same paper you will go to, you will find that 100% of the vats of milk, which contain more than 500 samples, in other words, are from more than 500 cows, are infected 100% of the time. All right. A lot of people are concerned about the high infection rate with these cancer-causing viruses, the immune-suppressing viruses. When I say a lot of people, I'm talking about people in Europe, because many European countries have decided to kill off their infected animals to protect their citizens. Here's an example of Finland, who completed an eradication program in 1996. After 30 years, they killed all the sick cows. The financial cost had to be huge. And many other countries are doing the same thing, but not us, not in the United States or Argentina or Canada. So how do these viruses get spread? It's because of common, current, everyday farming practices. And that is that infections are transferred around the farm lot by things like using the same syringe and same needle to give antibiotics and other drugs to animals, using the same dehorning instruments going from cow to cow to cow, using the same tattoo instruments going from cow to cow to cow. Without changing the gloves, they do rectal probes on cows from cow to cow to cow. Baby cows eat from mother cows that are infected. They pull the colostrum, which means they pull a whole bunch of early cow's milk and they feed it to the calves. That's how they get it. Big turning point was in 1996 when Howard Lyman, the mad cowboy, a friend of mine, frequent visitor to our program. Howard Lyman appeared on Oprah Winfrey's show. And she talked to Oprah about the problems of cattle. And she talked about mad cow disease. First time the American public heard about mad cow disease. I'd actually talked about it to the public before, which we'll get to in a minute. But this is the first time the general public heard about mad cow disease. And Howard Lyman, who was an MD and a PhD and a former dairy inspector for the state of California. Oh, no, he wasn't that. Virgil Hall was. I'm sorry. Howard Lyman is a dairy cattle farmer. Howard Lyman is. Howard Lyman, he told Oprah, he said, the reason that the infection is so abhorrent is because of a common practice in your cattle, your livestock industry, and that's to take dead and dying animals and feed them to live animals. In the case of cows, they call them downers. So they take a cow that's sick with leukemia or other deadly diseases or viruses, cancers, and so on, and they're not dead yet, or maybe they are dead, and they pick them up in a forklift and they take them over to the cattle feed and they mix them up with the grains. Oprah said, after hearing that, I will never eat another hamburger again. And she spent the next year in Texas being sued by the cattle industry. They lost, she won. Well, okay, remember, these are decent people just like you and I in the cattle industry. They're just people. And so they decided to do the right thing. After the Oprah Winfrey show, they banned the feeding of dead cows to live cows. But today, they still do what is discussed in the June 10th, 2003 front page article in USA Today. And that is, consumers may have a beef with cattle feed. They no longer feed dead and dying cows to live cows, but they do feed dead and dying cows to pigs and to poultry. And then what they do is they collect the floor scrapings and they compress the floor scrapings into tablets, which they sell back to the cattle industry, which they feed to cows. You can imagine, I mean, the floor sweepings have to be contaminated with pig poop and chicken poop and leftovers that fell out of their lips, and oh my goodness. There's also the waste plate exemption. The waste plate exemption means that if you went, and I know you'll never do this again, went to a restaurant, ordered a tri-tip, didn't finish it, they have a little basket in the other room in the kitchen where they could put that, they could feed that to live cows. And these dead and dying cows, they don't want to waste them, so they grind them up and make them into pet food. And believe it or not, there are unethical cattle farmers that buy pet food and feed it to their cows. And the industry say, you know, we just can't do anything about it because it just costs so much money if we did otherwise. They even take the blood of the cattle that they slaughter and they make a more milk formula out of it, which it infects the calves. Nationwide, worldwide, you look at the incidence of leukemia or lymphoma, and what you find is there's a straight line correlation. In parts of the world where they have a high consumption of dairy, they have a high incidence of these diseases. People who work with cattle, like butchers and veterinarians and dairy farmers, they're at a higher risk of getting these viral infections and these cancers than the general population. If you go to the, you know, there's one slide I wanted to note back there. It was written, but I didn't say anything about it. When I was telling you about the infection, I didn't mention that there was a study, and it's showed on the slide, it's worth pointing out. There was a study that was published in 1974 where they took 6 young chimpanzees and they fed them cow's milk. And before the end of a year, 2 died of leukemia. You can read that study, maybe as a nighttime story to your children. Anyway, let's get back to the general leukemia lymphoma discussion. If you happen to have a problem in your family and you go to the doctor and you say to the doctor, my little girl has leukemia, doctor, which 60,000 little kids end up with every year. What causes it? Well, what does the doctor say? The doctor says, we don't know the cause. Or you take grandpa to the doctor and say, hey, grandpa's got lymphoma, how'd you get it? Well, we as medical doctors, we don't know how you get these diseases. And nor would we even consider the experience of other animals and other disciplines. Like, for example, if you have a cat, if you have a kitty cat, a routine vaccination for that cat is a feline leukemia virus vaccine. Somehow, veterinarians know the leukemia can be a viral infection, but doctors don't. All right. Well, they've known about this since 1969, okay? And the problem is that they've considered it a non-problem. When I say they, I mean the cattle industry and the USDA. They've considered this not to be a problem. And the reason is because the early testing methods could not distinguish between bovine leukemia virus and human leukemia virus. Therefore, they couldn't really detect bovine leukemia viruses in human beings. Well, this all changed with the publication of this paper from UC Davis, where investigators took people off the street, about 260 people. They went up to them, they said, let me have your blood. And what they did is by taking their blood and using new immunofluorescent technology, which is highly specific, highly sensitive, they were able to find out that randomly tested people off the street, 74% of them had been infected with bovine leukemia viruses. Doesn't mean they're currently infected, but at one time or another, they had been infected, they had made antibodies against this leukemia virus, therefore they'd been exposed. Fortunately, very few people get leukemia or lymphomas, but all too many do. This organization, by the way, publishes current research. For example, they just came out with a paper. This was published in, very recently. I can't tell, maybe 92. Oh, here it is, 2019. Same research group. They say 1/3 of people have actual virus in their cells. Do you understand what I'm saying? Are you watching? Are you listening? 1/3 of people are infected with this virus currently. Anyway, they find the virus in breast cancer cells and all kinds of upfront research done on this. But I have to tell you, the press won't touch it. I've been to Associated Press. I've been to USA Today. I've been all over the place. They won't touch this subject. They're too afraid. I've only seen it published publicly once in a newspaper article. Oh, this would get people to think twice about feeding their kids a tall, cool glass of leukemia virus, don't you think? All right, here's their recent publication on the bovine leukemia virus in breast cancer cells. Something to be concerned about. And here's the paper I was telling you about that you could get right now off the, you could get this from the Centers of Epidemiology and Animal Health. And this is the infection problem that I told you about. And you see there that if over 500 cows have been added to a vat of milk, that the chances of being infected with these viruses is 100%. There's the paper. Think about it. All right, let's talk about kids for a minute. Now, you know, this is their market is kids. And they work really hard to make sure the kids drink the milk. They have all kinds of promotion, and even to the point where they considered it to be a criminal offense not to feed your kids milk. That's the way people thought. You can remember that. I remember when I was a kid, boy, milk was so essential. I mean, I was raised from post-Depression parents, and they wanted to make sure we always got enough because they got too little during the Depression. I grew up in a very poor family, too. Finances were a big deal for us every day. And I'd go to school in the morning, and I had a choice for morning break. I'm talking about when I was 5, 6, 7, 8 years old. I had a choice of a morning break. I could either have tomato juice that was unsalted, unpalatable, or I could have white milk or chocolate milk. Well, the white milk was 2 cents, the chocolate milk was 3 cents, and I want you to know, I felt guilty spending the extra penny, but I couldn't get the white milk down. You know, they color the milk, they flavor the milk, they throw sugar in it, they put it in cartons so you can't see it, they make you drink it through straws so you can't see it. They do everything they can, and they successfully get kids to drink most of the milk. Let's talk about one problem, just one problem that should get the dairy industry out of the schools. We talked a little bit about my kids and my grandkids being well aware that constipation occurs in their classmates, and it's quite troublesome. Well, as a general practitioner, I can tell you, I saw every day 3 or 4 families where the mom would come in and talk about Sally or Sam having terrible stomach aches, and well, how's the bowel habits? Well, they're normal bowel habits. Well, tell me what their bowel habits are like. Well, you know, they go, get in there and they go, okay. Well, tell me what your bowel habits are like. Well, I go in there and I, you know, spend 15 minutes, a half an hour, read 2 chapters of Reader's Digest. Yeah. I mean, constipation is the norm for the kids and the adults. Well, let's take a look at a study published in 1998 in the New England Journal of Medicine, where they looked at kids that were severely constipated. To get into this particular group, you had to have a bowel movement every 3 to 15 days with a laxative. Now, they did examinations on these kids. They took a sigmoid, which is a long silver tube they used to use back in those days, and stuck it up the kids' butts, and they took biopsies. Well, what they found is when they took the kids off cow's milk, that nearly 70% of them were cured of their constipation. And when they took the biopsies, when the kids were drinking milk, they found fissures and inflammation of the bowel wall, fissures being cracks, bleeding cracks, painful inflamed cracks, horrible pain on biopsy. Well, it wasn't just the fact that this cow milk was lacking dietary fiber. It was the fact that the cow milk protein caused an inflammatory reaction of the child's bowel, which prevented the bowel from moving. Well, anyway, the kids were cured of constipation. They put the kids back on cow's milk. 8 to 12 months later, they put them back on cow's milk. They were all sick in 5 to 10 days. Just for that reason alone, you'd ban cow's milk from schools. You'd treat an honest message, wouldn't you, if you were in control? You know, it reminds me of another study that was published in 2013 in the New England Journal of Medicine. They took 4 children who were dying of kidney disease. They had what we call nephropathy. The body was attacking their kidneys. And they wrote this extensive article. It must have been a 20-page article with this beautiful fluorescent photographs where they showed these kids and how they took biopsies of their kidneys, and they showed antibodies directed towards cow protein attacking the children's kidneys with beautiful fluorescent pictures. And they took the 4 kids off the cow's milk, and they were all cured. I haven't seen this scientific revelation discussed since. You know, it should be on every pediatrician's lips. Oh, why wasn't it discussed? Well, In the 1980s, the Lancet had contained a seminal article about kidney disease in kids. And they took them off the cow's milk, and they were basically all cured. Back then, they asked the parents of this study to put the kids back on cow's milk, and they said no. They wouldn't do it. So this kind of information goes no place. Why? Why does it go no place? Because it has no value. And value has to do with things that turn into profits for stockholders and business owners. Get real, folks. Anyway, there are multiple studies on constipation and the American diet, and dairy is just one of them. But you should expect 100% cure, pretty much. Snotty nose, ear infections. You know, your kids are sick. Look at them. They're going to the doctor every month or two with ear infections. That's not right. That's not right. You know, there's something wrong. Kids aren't supposed to be sick. Well, it's because of the food. You know, 70% are obese. 17% of the children are obese. Another 17% are overweight. They're all constipated. They're headachy. And, oh, hey, civilized people take care of their children, ladies and gentlemen. All right, the Pediatrics Society, they got together in 1994. I just show you this because we've known this forever. And they decided that type 1 diabetes was due to an autoimmune reaction involving cow milk protein. What happens is the cow milk protein goes through the bloodstream. It's now floating around in the blood. The body makes antibodies to the cow milk protein because this is a foreign, this is cow protein. These antibodies cross-react through a process called molecular mimicry with the insulin-producing cells of the pancreas and destroy these insulin-producing cells. We have identified the 17 amino acids that are shared between the cow milk protein and the surface of the pancreatic cells that make the insulin. We've already identified the 17 amino acids. You want to ruin a family, you give them a case of type 1 diabetes. I'll tell you, that whole family, the rest of their lives will be centered around that problem. All right, you could go to the internet. When we get done, I hope you do. And you can look up cow's milk or dairy products and any of these problems. And what you'll find are a few or multiple or definitely causal relationship articles between these problems and dairy foods. The research is overwhelming. Canker sores, tonsil enlargement. You know, the tonsils are there as your first line of defense. That wasn't a mistake to put tonsils there and the adenoids, which is called the Wallerian ring. This defense layer of immune tissue is there because it confronts the world around you first. And if you're constantly being invaded by foreign protein at a level the body was never intended to, which would be eating from the food of a baby cow, then you constantly bombard your system and the tonsils, they enlarge and swell. They're supposed to, they're trying to defend you. And they swell to the point where you can't breathe sometimes. There's a guy named Boat who took people who had they were drowning in their own fluids, these young people, from the tonsil enlargement, and they took them off the cow's milk and they cured them. Vomiting, GERD, ulcer disease, colic, stomach problems, lower intestinal problems like bloody stools, painful defecation, chronic constipation, colitis, Crohn's disease, ulcerative colitis. And by the way, this list is even expanded upon at the end of the chapter in the book, The Starch Solution, when friends ask, where do I get my calcium? This whole chart, all these diseases are listed for you, so you can go in, or it's written in some of my newsletters too. So you want to look them up, there they are. Snotty nose, ear infections, wheezing, asthma problems, various kinds of arthritis. You want to see a sad situation. You see a kid with juvenile rheumatoid arthritis. I've seen probably 4 in my life. But I've had a chance to help 2 of them. You know, they're shriveled up little refugees, as young adults with jaws so tiny they can hardly open their mouth and little hands that go like this. And they sit in wheelchairs. Look like refugees ready to die because they're so diseased. Well, I've had the chance to interact with 2 of the families and stop this nonsense. Anyway, we take care of a lot of arthritises, and people respond quickly, usually within 4 to 7 days. Within 4 months, if your arthritis is going to respond, and almost all of them do, you're going to respond with a dramatic decrease in arthritis, inflammation in your disease. Rashes like atopic dermatitis, eczema, seborrhea, hives, multiple sclerosis, Parkinson's, autism, schizophrenia, fatigue, mental depression, bedwetting problems. This is a fun one. Mary and I went to talk to the Young Presidents Association in Colorado. Young Presidents Association means you have to be the president of a major company. You have to be younger than 40 years old, and the company has to make more than $5 million a year. Okay, so these are the high-stake rollers in the country, and we were invited to talk. I got up and gave a day-long presentation. During my presentation, my host, of course, introduced himself and his wife, and he was not happy about what I had to say, but she was. And that night, the host's job was to take Mary and I out to dinner. And this man, who happened to be the head of the largest hotel chain in the country, ordered a 1.5-inch thick steak and 2 black labels and proceeded to tell me exactly what he thought of me. And I want to tell you, folks, that hasn't happened very often in my career. Well, I kind of swallowed it up and decided not to cause any problems and went home and didn't think anything more about it. And then I got a letter from him about 6 months later. He said, I want to apologize. My wife listened to you carefully, and I have 2 boys, age 9 and 11. And they'd wet their bed every night for as long as I can remember. And my wife heard what you had to say, and she took the kids off the cow's milk. And I want you to know those kids only wet their bed once when they stayed overnight at friends and had ice cream. He said, I'm sorry. He was a big man. See, what happens is the cow's milk gets into the bladder, causes the bladder to swell. The kids can't feel the urine. It builds up, and they just urinate. Whereas the parents think it's some kind of psychological problem. I must have hurt the kid sexually and mentally. After all, I reached down and touched his genitals with my fingers when I changed his diaper. Maybe that's the problem. Excuse me, ladies and gentlemen, it's the cow's milk. All right. Iron deficiency, anemia, I already talked to you about that. I talked about nephrotic syndrome, kidney damage. You want to damage your arteries, cow's milk's a good way to do it. All right, well, let's get to the end of this talk. The dairy industry is well aware of this, okay? That's why they have this large fund out there to support false information. And by the way, to deals with issues of concern, which I have been for 30 years. I've been one of the issues of the dairy industry. Well, this came to a head in 1993. I had, as a guest on my co-hosted TV show, Lifestyle Magazine, which played for almost 30 years worldwide in 95% of the households. My own show, McDougall MD, it played for 6 in 95% of households. But this was, the longest show that I did co-host. In 93, I had Virgil Hulse, who was an MD, PhD, and former dairy inspector for the state of California. We talked about heart disease, and diabetes, and allergies. And this was the first time, as far as I'm aware, that mad cow was talked about in a public forum. We talked about mad cow disease in this January 1993 show. Well, the dairy industry, they heard this, and they said, well, we want to send our representative down. So in July of 1993, they sent Greg Miller. Greg Miller has a PhD in nutrition. He's a big shot. He was head of public relations of the dairy industry back in those days. He's head of Dairy Management Incorporated, their PR department now. So here I am on stage with Greg Miller. You can tell the difference between the two of us. And you see what I'm doing to him. Heart disease, diabetes, obesity, constipation. 1, 2, 3, bam, bam, bam. Well, what's his response? He says, look, we're nice people at the dairy industry, and we're really, well, you are nice people. But how about contradicting any things I had to say? No, he wouldn't do that. His only argument, 3 minutes into the presentation, he reached into his coat pocket. And he pulls out a picture of his kids, and he says, if there's anything wrong with dairy, I wouldn't feed them to my kids. Well, these shows are available for you to watch, both of them, Virgil Hulse show and the Greg Miller show. A lot of people do. They're on a set of tapes called McDougall's Medicine, Fighting the Big Fat Lies for Fat-Free Truth. You can either buy them on the internet or get them as, we may still have a few as DVDs, but they're available on our store. And a lot of people will take these shows and they'll show the one I did with Virgil Halls to their friends or health group or whatever. They'll say, wow, boy, this McDougall, he really comes down on the dairy industry badly. They must have a response. And of course, everybody agrees there must be a response. And the invitation is given. Come back and I'll show you the response. Well, when they show them the response, and the only response the dairy industry has is to say that if there's something wrong with dairy, I wouldn't feed them to my kids, and doesn't deny anything I had to say, well, people are shocked. But that's what the truth is. They have nothing to say to defend their products. All right, it's gotten to the point where the Canadian dietary guidelines changed in 2019. The dietitians involved in the dietary guidelines that were published in 2019 did not allow industry to be involved with any undue influence. The food industries, they got one vote, just like every citizen did, one vote. And as a result, they came down with recommendations that were clear. You drink water for a beverage, and you shouldn't be eating the dairy and meat that you're eating. Clearly. Now, our dietary guidelines, unfortunately, are too much influenced by the industries for them to come out with honest recommendations. So don't expect it for the U.S. government yet. They will eventually. I mean, you know how it is. The truth does finally win over. All right. The American Medical Association, they came out in 2020 with their dietary guidelines. They told Americans that meat and dairy are not indicated in an optimal diet. See, so progress is being made. So here we come to the kind of closing arguments that I have for you, and that is that I want you to think about dairy as liquid meat. Before you came to us through the internet, you believed, you knew that eating red meat was not good for you. You knew that. Come on. You may be a denier, but you knew it. Well, let's compare ground chuck beef with cheddar cheese and see how much they differ. They're both about 70% fat. They're both about 30% protein. They both contain virtually no carbohydrate, no dietary fiber, the same cholesterol. They're basically dairy is liquid meat. So, in my final persuasive words, I will offer you a challenge. And that is, I want you to just give up one of the two remaining food groups. You've already accepted the fruit and vegetable and the grain group as being healthy, so we don't have to fight about those. Let's decide on whether you're going to take out of your family's diet the animal product in form of meat or the animal product in form of dairy. Where are you going to get the most benefits? What's the change that should be made first? Well, ladies and gentlemen, you need to start working on the dairy. Dairy's liquid meat, plus worse. It causes more autoimmune diseases. But the real problem with dairy is this. It's our attitude towards dairy thanks to the dairy industry. We come into this food believing that it's health food. We eat it with a guiltless conscience. We look at the block of cheese and we go, oh, I need my calcium. You don't go, ugh, a whole bunch of leukemia viruses. I wonder if I'll get those down today without catching leukemia. No, you don't say any of those things. So give up the dairy first. And as this other structure says, it's time to take Elsie out to pasture. Ladies and gentlemen, I'd be glad for your questions or challenges.